Hello, and welcome to the Addiction Recovery Place podcast. I'm your host, Chris Langley. I'd like to introduce you to today's guest. Shannon Anderson is the HR fairy godmother. I love that title. Culture driver and CEO of GritHR Solutions. Her company provides strategic outsourced HR solutions for clients looking for redefine and enhance the people operations and employee experience. Thanks very much for being here, Shannon.
Hey, Chris, thanks so much for having me. I'm excited to be speaking with you today.
Oh, thank you very much. I really appreciate your time anyway. I know you're very busy, but what I wanted to do was have you on the podcast today to talk about your experience and obviously how HR is such a vital component to any service, and especially within addiction treatment or social care services due to confidentiality and all the many things that can kind of come at an HR department. So obviously I'd love to speak to you about that. So we're going to kick off with a nice easy one for you first. So how can an HR team support people in the workplace who are experiencing addiction or who are in recovery themselves?
Yeah, absolutely. So really, and I know you and I talked about this prior to today's conversation, but I really believe, and I've really seen where proactive HR and approachable HR, which is what all HR professionals are trying to be, can really play that pivotal role by helping to foster that environment of understanding and support. I think anybody that I've ever worked with addiction, that's the number one thing, is just that support and that understanding and that no judgment for them. And then creating as HR, creating those policies that encourage people to seek help, providing access to professional resources, and really trying to work towards that stigma-free workplace. And some of that includes like regular training for managers and staff on how to identify and sensitively respond to signs of addiction. I think it's so critical, especially because there's so much of it that is covered under the Americans with Disabilities Act as a protected condition, so long as the person is actively seeking treatment. And that's the key thing. And a lot of HR professionals don't know that. A lot of managers don't know that. And a lot of people that are seeking treatment don't know that they have disability protections under federal law for them. And some states, are going to have greater protections for them. But the big thing they need to know is that everybody should know is ADA. But most importantly, I really think HR needs to learn to prioritize that confidentiality and respect for those that are seeking assistance, and then continuously be that advocate for their rights under the ADA or any other state-related leaves that are protected.
Could you tell us a little bit about the ADA? Being a Brit as well, I've probably not heard of this before, but I didn't realise it was under federal law as well. So if you can just tell us a little bit about that piece of legislation, that would be fantastic.
Yeah, so the ADA is the Americans with Disabilities Act, and it was first passed. This is why whenever we go somewhere in public and we walk into a public restroom and we see the really big stalls and the grab bars for somebody who may have mobility challenges, or the wheelchair ramps for getting into a building, that was born out of the ADA to make places accessible, and it was expanded into the workplace to provide employees that can do the essential functions of the job with accommodations. So the ADA specifically says, with or without accommodation, can you do the essential functions of the job? If I'm a rocket scientist and I don't know how to be a rocket scientist, it doesn't matter how many accommodations you give me, I'm never going to be able to do the essential functions of the job. But if I can do the essential functions of the job, say I'm working in a call center and I am seeking recovery treatment for alcoholism, and there's a group therapy session that I want to go to that starts at 5 p.m. every Wednesday. A reasonable accommodation in that place would then be for me to possibly work with my manager and my HR team at my place of employment to say, I really need to have an adjusted schedule that on Wednesdays, I'd like to try that for the next 12 weeks by 1 hour, just so I can go do this. And how can I make up that hour throughout the week? Can I take less lunch? Can I stay later? But really, to answer your question, it's about providing people with equitable access to work with or without those accommodations. And it covers a myriad of different disabilities, but addiction that's an active treatment is covered as a disability under the ADA.
Wow. So somebody who's an employee can, as long as they're accessing some form of service, is there any kind of benchmark as to the service they have to provide? Does it have to be a weekly thing, or is it just you're seeing a professional for your addiction?
Right. You're seeking treatment for your addiction. Okay. That could be something as simple as, and it's not simple, it sounds simple when we talk about it, as going to daily, weekly AA meetings. It could be maybe you go to inpatient rehab for a month and you take a month leave of absence. Maybe you do a week leave of absence and then you're going to outpatient treatment every day, right? Like there's so many different ways that could look. But as long as you are in treatment and not using, that's the key thing, then you are covered under the ADA.
So you're protected. Wow. That's quite a bit of legislation and something very, I don't know whether many people understand that addiction is part of that legislation as well. So that's a big one. So no, thank you very much for explaining to me to that. I didn't know that at all. So that's great. Recovery professionals help people plan strategies if they relapse, which invariably happens, unfortunately. But how would you recommend an employee approach communicating a relapse with their employer's HR department? What would you do to?
Yeah. So a couple of things. One, transparency and honesty are really going to be key here. And that requires somebody to be vulnerable. But if they're committed to getting better and working on that, then that vulnerability is going to go a long way in having that empathy and support from your employer. Another really great resource I want to point out is askjan.org, which is a website sponsored by the Department of Labor and a couple of other providers. And JAN stands for the Job Accommodation Network. So not just for addiction, you could go in and look at this for any disability, but you could go in and as an employer, as HR, as the employee, you could go and type in what the disability is, and they can send you tons and tons of ideas of ways to have that conversation, possible accommodations. If you work in a very niche environment, you can actually reach out to them. It's 100% free for that guidance on how you might be able to accommodate in that niche environment or that niche position as well. So knowing that resource, I think, is great for anybody that works with anyone in recovery, whether you're the person in recovery, you're the employer, you're an addiction counselor, anything like that could be helpful. And employers need to approach or employees rather need to approach HR with a clear communication of their situation, emphasizing their commitment to that recovery and their need for support. And HR and employers really should respond with that compassion, offering that guidance on available resources and being able to adjust those work responsibilities as necessary, always ensuring that privacy and dignity.
Because the problem with addiction above any other disability or condition is the stigma. And that to me is half the battle, I think. And if you can overcome the stigma within a workplace, that makes the rest of it so much easier. So no, that's right. Yeah, definitely. That's my own personal view, but you know.
No, I totally agree with you on that. And you know, some people, I kind of think of it, at least from my perspective, in terms of let's compare it to a diabetic, right? We may not know somebody's diabetic until they tell us that they're diabetic, and they need to take, you know, if their sugar drops or something like that and they need to take a break immediately, we're going to accommodate that because that's life-saving measures, right, in some situations. So, and this is this is not a full apples to apples comparison, but why would we then not say, okay, we're not judging you for having diabetes. We're not attaching a stigma to you having diabetes. You have tools in your toolbox to help you maintain that baseline. So addiction treatment and accommodations and all of that should be a tool in the toolbox to helping that person live their best life.
Yeah. I mean, it always helps, I think, if you've got a good HR department that you know that you can trust to go and talk to about your problems, because the worst things you could do in a workplace is to ignore the problems that you're experiencing outside of work, and especially when it's a medical problem as well, such as addiction, or as you said, diabetes, or, you know, any other health issue. So obviously being very open within HR is a vital component. So how can HR help with employee relations? I mean, what's the, you know, how can HR do that?
Yeah, so HR is really that bridge between the employee and management, right? Like at the end of the day, the core function of HR, if we really strip down all the layers, it's really to be of service to the business. But by being of service to the business, we are being of service to the employee, the manager, and doing what's best to balance the needs of all of them at the same time. At least that's my view of how HR should work and how a good HR department should operate. So to really answer that question, HR is there to help facilitate that open communication, the understanding, helping the employee if maybe the employee is ready to share with their manager or let their manager know, but maybe they're too scared to talk about it. HR can help either facilitate that conversation, start that conversation for the employee, and, help that person. HR is not there to be counselors. We're not licensed counselors, but we can help employees access counseling, help managers access training. If there's any conflicts, help mediate those conflicts, and really develop individualized programs and solutions that nurture that positive work environment. So really, HR is that architect of the workplace culture and values that support everybody. And this is just another pillar of that architecture.
That's a perfect answer. that really is. That sums up everything that I believe in. I couldn't have answered that better myself. So in what ways does a supportive HR environment contribute to reducing burnout? Because burnout happens so much within social care, addiction treatment services, because you're in the firing line of all these clients' issues and stress and strains. So burnout and turnover rates are pretty high amongst the profession that I certainly used to work in, and I felt burnout on a pretty much weekly basis. So how does having a supportive HR, support burnout? What are the things that HR can do to kind of solidify the team to make sure that they're supported and that they don't get burnout and just don't walk out on the job, which happens, unfortunately?
Right. I think some of that is about HR recognizing that work in addiction is high. It's a high stress level environment, and there's probably no 2 days that are the same. And so some of that is about like the proactive measures, like providing flexible work schedules, offering regular check-ins, access to wellness programs for employees to help people maintain that healthy work-life balance, but also recognizing when somebody's not acting like themselves. They're starting to show signs of burnout, and we can pull them aside and have that conversation to say, Chris, you're not being yourself. We're all entitled to a bad day. We're human. We're entitled to a bad day. You're showing signs of burnout. What support do you need? And again, we're creating safe and space for employees. Well, our addiction counselors, our addiction professionals are also employees that need that safe space to maybe vent, maybe take a 3-day weekend and just, do something for themselves. So really just looking out for their well-being overall.
Yeah. So it's just being aware of what's going on with each person, and obviously checking in on them. And if there are any signs from their line manager, then HR can step in and help. So, okay, that makes a lot of sense to me. So how can a well-structured HR process positively impact the overall well-being of addiction professionals or people working in this sector?
Really well-structured processes really give us that clear communication, those clear expectations, fair policies, and accessible support systems, right? So sometimes we talk about like EAP, where they can call and confidentially talk about an issue, get help doing different things. I've seen some EAPs that are really great. They're, the old version of an EAP was, I'm going through a mental health crisis. I need advice. You're going to give me 3 free counseling sessions. These EAPs, these employee assistant programs that are out there now, are like a life concierge service where maybe I'm moving my kids and I are moving 50 miles away from our current house, and I need to research doctors, schools, banks, a myriad of things that would take hours and hours of my time that I'm just too exhausted to deal with after work. I know stories of people who have called into these employee assistance programs, told them the story, and in 72 hours, they have an email with 100 of the closest doctors in a 5-mile radius in the plan network. The best 5 schools, their ratings, their addresses, their locations, all these life things that, and it's such a small thing that we don't think about. But I think about when I unwind at the end of the day, all the things I want to do around my house, all the things I want to do project-wise. And then I'm tired and I don't want to do them and I don't want to lift a finger. And so just helping people find that balance in little things like that, making sure that just doing things like this actually really just help give that sense of security and belonging, which we all need. And that's essential for our professional and emotional well-being, because we can't, it's so cheesy, but I'm sure in the helping field, you say this all the time. I know I do. We can't pour from an empty cup. And having a full cup means that all sections of our life are as balanced as they can be.
Yeah, no, that's wonderful. So What are some of the risks of not having good HR processes in place? Because, it happens, but when bad processes are there, problems arise so much more quickly. So can you just tell us a little bit about, what are the risks of a service not having HR policies, procedures in place, and what can happen?
So I always think about, I'm sure you've had jobs where you walk in, you fill out a couple pieces of paper, and you just kind of start drinking from the fire hose, right? It's chaotic. It's not supportive. You're like, what the heck am I supposed to do? That's the same risk if you don't have effective HR and processes in place, because nobody knows what they're supposed to do. Nobody knows what the expectations are. So that leads to that stress, poor job satisfaction, and our higher turnover rates, and even possible like legal issues if things aren't being complied with, right? Like if you don't do training on HIPAA and privacy and things like that, and an employee goes out and talks about, I had, so-and-so come in today and they're an addict on this, and their friend or family member hears you over talking about that over dinner, you've got a lawsuit on your hands. You've got a HIPAA violation on your hands in all of these things. And that's just, that's a very low hanging fruit example. But if you don't properly train people on that, they don't know what they don't know.
That's right. Can you tell us a little about HIPAA?
So my knowledge on HIPAA is probably more than most, but not as great as yours or other people's. But HIPAA, is that Health Insurance Portability and Accountability Act. And I know that's a big fancy word for saying in the US, that's the way that we protect your privacy, your medical privacy, so that same example that I just gave, I can go to dinner. I can say, oh, I have this new patient. I have this new client. And he told me a really interesting story today. And here's the story he told me. No names are identified. Nothing is shared. You could be talking about anybody. Nobody knows. Anybody can overhear that story and they're protected. You're protected. But it's about, where you sign acknowledgments to your rights. You see this every time you go to the doctor. Who is allowed to know your private medical information? And they can only disclose that private medical information to people that are on that list on a need-to-know basis. Your doctor can't just call up your husband and say, oh, Shannon came in today and she was talking about how frustrated she was with you. A, that's not medically related. And B, there's no need to know that. So it's really about those things and, keeping your information confidential and protected. That's exactly what it's for.
Yeah, so it's just literally just confidentiality and to make sure that everything is kept on, secure and tight. So, okay. How long has HIPAA been around for in America? Is it quite an old legislation or?
Without Googling, I want to say it came out in the late 90s, if I'm not mistaken. And I'm not checking on Google right now. My hands are up. I'm not Googling it because I want to say it's either the late 90s or early 2000s when I remember starting to hear about it.
Okay. So it's been around for quite a long time. So it's quite a very established piece of law within HR. Okay.
Correct. And some states have other, further than that. Like Texas, for example, has the Texas Medical Privacy Act. So if you're somebody who lives in Texas, Texas also has its own that acts just like HIPAA, might have a couple extra protections, but HIPAA is that federal line.
Okay. So different states can have different levels, but there is a federal limit on.
Correct. Thinking about addiction, let's say you told me, hey, I went to the hospital today. I can't call the hospital and say, did Chris come in today? What was he seen for? Who did he see? What time he was there? I can't do any of that. And they can't release any of that information. Now, say you came back to work with a doctor's note and it said, Chris was seen on this date. He may return to work on this date with no restrictions. Right? All that's verifying is that you were seen by the doctor. I can't call and ask any questions. The only thing I could do, maybe for some reason I thought that wasn't a valid doctor's note. I could call and say, hey, is this your template? And the doctor can say yes. The doctor's office can say, yes, this is our template. That's how we write it. That provider is a provider of ours. That's all they can say. They cannot confirm or deny if you're a patient. They can't confirm or deny that you were treated. Nothing unless you sign a release and they have that release on file.
Gotcha. Okay. That explains it very, very well. Very important piece of legislation, obviously, with data protection and, given what's happening now within the digital world, it kind of raises the risk somewhat, especially with social media and the other kind of, how we communicate as well nowadays. So, okay. So last couple of questions, Shannon. How does effective HR support foster a culture of accountability and professionalism amongst addiction professionals, particularly in managing sensitive issues like confidentiality?
Right. So I can't stress this enough, and people laugh at me. I've had CEOs and business owners be like, why do I have to have an employee handbook, for example? And I explain to them, it's the thing that sets your expectations and your guidelines for everybody, right? And so that is why that effective support in HR really, again, it sets the guidelines, and then it fosters a culture where that accountability and professionalism, but to me, most importantly, accountability are paramount. So, and some of that includes training on our ethical practices, confidentiality, best practices, creating that safe space to report concerns, or even just say, I've had a rough day today and I just need to talk. I don't need you to do anything. I just need you to hear me because I had an emotionally draining day today. And ensuring that consistent enforcement of those policies to create that equity within the workplace as well.
Okay, perfect. Just a couple more questions. So is there anything I've not covered today that you would like to speak about, to tell the listeners today about HR, and kind of anything that I've missed out on within my questions?
I would say, and this one's maybe more of a personal one, but like how we as HR professionals think about innovation in addressing unique challenges, especially in the addiction space. That's the one that comes to my mind.
Yep. Okay. That's perfect. Thank you. Last question. So where could people go to find more about you and GritHR?
Yeah, so to dive deeper into our world, you can visit our website at it's GritHR You can also follow us on LinkedIn, where we're posting content regularly, resources, and insights to really on how we're revolutionizing HR in not just the addiction recovery field, but there too. And then we also have a newsletter where people can get a monthly dose of our latest projects, compliance updates, and other success stories.
Perfect. Just to make sure, I'll make sure I have all the links on the YouTube down below. So anyone listening to this, check Shannon out. And thank you very much indeed for your time, Shannon, for telling us about your expertise and explaining why HR is so important within our profession. And I really appreciate your time today. Thank you very much indeed.
Yes, thank you for having me. It's been a great conversation.
Really appreciate it. Thanks, Shannon.